8:13 Thursday morning, brilliant sunshine, cool day. Time to join Dr. B, Dr. Brent Wallis, Chief Medical Officer at People's Health. Our friend, how you doing, Dr. B?
Hey, Tommy, I'm doing okay. How about you?
Good. Everything's safe yesterday. No worries. Everything's fine, right, with the tornadoes?
Yeah, thank goodness. I hope you too.
Yeah, God bless the people that are suffering, man. It's a tough time of year for it that were impacted. Medicare's annual enrollment period ended last week, but if you want to make changes to your Medicare coverage, you might still have a chance to do it. Dr. B is going to tell us right now from People's Health to explain how Medicare's 5-star rating system and the 5-star special enrollment period all work. First of all, Doc, what are the star ratings?
Sure. So Medicare actually developed the star rating system back in 2008. And what they were trying to do is develop really just a simple, unbiased way to evaluate how a health plan is doing, what their quality is, what their performance is. So ever since 2008, every year Medicare rates every established Medicare Advantage plan and prescription drug plan on a scale of 1 to 5. So in general, the better your plan performs, the more stars it receives. So when you're comparing plans that really have similar benefits, similar cost and coverage, you want to look at the star rating to help you make a decision, because a higher rating is really going to mean that it's a higher quality plan, in particular with higher levels of member satisfaction.
So how does Medicare determine a plan's star rating?
Yeah, so Medicare Advantage plans that have prescription drug coverage, like most of the People's Health plans, are rated on more than 40 individual unique quality and performance measures. So it's a whole lot that goes into, really the consideration of what your star rating is going to be, and that includes things like preventative and chronic care, which is really, how the plan helps their members stay healthy and how it helps them manage long-term medical conditions. But it also takes into account Part D coverage, which is your drug coverage. So, is the plan providing safe and cost-effective drug coverage? And then it also looks at member experience and customer service. So, is the member satisfied with what the plan is doing for them? And from a customer service standpoint, are you getting through to the plan? Are you getting what you need? Are your appeals or your enrollments being processed? And most of that, Medicare uses a lot of data that is sent to them, claims and member records and various things like that. But in particular for the experience-related measures, Medicare goes straight to the consumer, straight to the source, and actually surveys plan members to get feedback on their personal experience with the plan.
From all of that, I would imagine they don't just hand out these 5-star ratings.
Yeah, no, 5-star rating is definitely hard to get. It's really a sign of a top-performing plan, a plan that Medicare considers truly excellent. And so it's not easy at all to earn that rating. In fact, in 2023, only 11% of the Medicare Advantage plans with a contract are going to be awarded a 5-star rating, so very rare.
Are 5-star plans more expensive, though?
No, they're not. A lot of people think they may be, but really the cost of a Medicare Advantage plan is not based on its star rating at all. So it's very possible for a 5-star plan to have, lower cost than a plan with fewer stars. People's Health plans, we charge a $0 monthly premium and have $0 deductibles. So, and those plans are 5-star.
Is the 5-star plan, you would think, would always be the better option, but is that so?
No, it really isn't. Not always. You have to look at different things. It's not really one size fits all, and everyone's needs are going to be unique and different. So the star ratings are important, but you don't want to base your entire decision onto it, because you don't want to make a decision that doesn't address everything you're going to need in your next year of coverage. And so, a couple of things to think about is make sure that your doctors are in the plan's network. If they're not, you're going to have to choose new doctors, and you may not want to do that. And then you really want to make sure that your prescription drugs, anything that you're taking, medications, all of those things are covered as well. And then if there's a benefit in particular that you use regularly, make sure that that's going to be covered. If it's not covered on a 5-star plan, but it is on a lower plan, that may be what you want to choose. So it's really a careful review process you have to do every year.
It's all in the details, isn't it?
Definitely.
Always is. When do they announce these star ratings?
Yeah, so they come out every October, so the ratings just came out not too long ago, and they're effective for the next calendar year. So most People's Health plans are rated 5 out of 5 stars for this year, for 2022. And those are our plans we call health maintenance organizations or HMOs or our special needs or SNP plans. And we're really excited to say for 2023, all of those plans were again rated 5 out of 5 stars. So we're super excited about that. And what that really means to us is it means that we're consistently considered a top-notch plan. You know, a plan that really tries to keep their members in mind, keep their members satisfied, and try to really push living a healthier life.
That seems like the Super Bowl. When you accomplish that, that's a big deal.
It's very exciting. Yeah, we get excited every October.
I can imagine. How can you find a plan star rating?
Yeah, so it's really easy. You know, the best place to go is Medicare.gov on the web. And they have a plan finder tool there, and it's really easy. You enter your zip code, and it'll actually show you all of the plans that are available in your area, and it's going to list what their star rating is. So if you see a plan that's got a little gold star icon next to the name, then that means it's a 5-star rated plan. You may also see some plans that have a red alert icon, and what that means is those are plans that are low performing. That means that they really are below 3 stars for 3 years in a row. So those are plans, you know, you may want to really consider, not choosing depending on what your needs are going to be. And then, you know, the other thing you can do if you're not on the web is really you can call 1-800-MEDICARE, and they can talk you through that whole process as well.
All right, let's take a quick break. We'll digest what we've heard so far. When we come back, we'll talk about what does it mean if a plan doesn't have a star rating, and are there different enrollment options for 5-star plans? We're talking with Dr. B, our friend Dr. Brent Wallis, Chief Medical Officer of People's Health, about the Medicare's annual enrollment period, and you might still have a chance to change it if you change to a 5-star plan with a 5-star rating, which People's Health is. 8:20 now, traffic, WWL. 8:26, Tommy Tucker, WWL. Quickly back to Dr. Brent Wallis, Chief Medical Officer of People's Health. And Dr. B is talking about Medicare enrollment and 5-star plans and how you can still enroll if it is for a 5-star plan. I believe we'll get to that in a second. Doc, what does it mean if a plan does not have a star rating?
Yeah, so when you're looking on that plan finder search tool, there may be plans that don't have a rating, and it doesn't mean that they're not good quality plans. It typically just means that they're too new to be rated. Medicare's got to collect a lot of information, especially since there's a lot of measures that are measured over time, like chronic care management and stuff. So if you don't have enough time to do that, you won't get a rating, and so they'll sit without a star rating for a couple of years.
All right, let's talk about different enrollment options for 5-star plans, which People's Health is.
Sure. So, you know, it gets confusing sometimes, but essentially the annual enrollment period, or AEP, is what we just finished. That's the period from October 15th to December 7th of each year, and that's when most people make changes to their Medicare coverage. But for a plan that is rated 5 stars, there's an additional enrollment period called the special enrollment period, and that's where they can actually offer a one-time change between last Thursday all the way until November 30th of next year.
Wow.
So what that essentially means is a member who's in a plan can actually decide to switch to a 5-star plan, you know, if they decide they want to once during that special enrollment period.
Are there other options for changing your Medicare coverage outside of the annual enrollment period?
Yeah, there are. And so, you know, there's something called open enrollment as well, just to make things more confusing, which runs from January 1st to March 31st of every year, so the first quarter of the year. And what that means, during that time, people that are enrolled in a Medicare Advantage plan can make a one-time change to their Medicare coverage. They can either switch to a different Medicare Advantage plan, or they can actually return to original Medicare. So that's really if you've changed your mind about the decision you made during the AEP period, you've got this first quarter of the year to make a change in that decision.
And they can also change it if they have some other things going on?
Yeah, they can. In particular, people that have both Medicare and Medicaid are eligible for changes as well. If you move service areas, so if you move, from New Orleans to another part of the state or out of the state, you're going to be able to make changes. And then people that actually were living in a long-term care facility, something like a nursing home, who then return back to their home, they can actually make a decision as well.
Doc, this is not simple, and Medicare can definitely be confusing. How can people find out more if they have a lot more questions?
Yeah, it gets extremely complex, and so sometimes you want to just sit down with someone and have a conversation about all of these things and really detail what your personal situation is going to be. So, what we offer for that is our People's Health Medicare Center. We opened that last October. You've been there before. We did a show there, and it's right at the intersection of Veterans and North Causeway next to Party City. It's really a great place to come in, sit down, talk with some of our representatives, ask them any questions you have. You can be for yourself or it can be for a family member. Walk-ins are welcome, but appointments are recommended. You can just give us a call, set up a time to come in, and we'll discuss all your options with you.
And to be clear, you're right. We have been there. This is not a used car lot. This is not Sam's Friendly Used Cars. They're just going to tell you about Medicare. Nobody's going to put the hard sell on you to get you to sign up for People's Health or anything. Thank you, Doctor. I appreciate your time.
Thanks, Tommy. Have a great weekend.
You too. The telephone number from the Medicare Center is 1-800-315-8782. And they are there to answer questions, make it easier for you to understand your Medicare options. And if you want to find out more about People's Health, you can go to peopleshealth.com. You can call 1-800-978-9765, or you can always follow People's Health on Facebook, Twitter, and Instagram. 8:30, time for WWL First News. For that, we go to Ian Ozan.